All right, well, today marks the beginning of phase 2 of our vaccination drive for COVID-19. It should see almost 5.5 million people aged 60 plus vaccinated. We know, of course, that nearly 500,000 healthcare workers have been vaccinated already under the Sisonke program. There's still some 700,000 healthcare workers who are awaiting their vaccination. So our reporters are all over the story, and with us I've got Heidi Giokos in Soweto, Silindelo Masikane in the Free State, and Lethiwe Mdluli, who joins me now from Kwazulu-Natal. Heidi, I'm going to start with you. The health minister, I think you were in Krugersdorp, you're now in Dobsonville, so you've sort of been all over the place. But you did catch up with the health minister when he visited one of the vaccination sites you were at. What did he have to say?
Yes, indeed, Sally, we do know that the health minister, together with the premier of the province and other health officials, were at 2 vaccination sites, or rather old age homes in Krugersdorp, overseeing the first day of phase 2, where those 60 and above can get vaccinated. And what's interesting about the first old age home that the minister was at is that those who are part of the community there in Krugersdorp are able to walk into the vaccination centre, get registered, and then get their jab. So that old age home, or that centre for the aged, is supporting the community there in Krugersdorp and helping those who want to register but were unable to due to not having a smartphone or not being able to do so, to register at that site and then, of course, get the jab. We do know that the minister says there is concern around the availability of vaccines in the country, as we only have Pfizer for now for phase 2. We are waiting for Johnson & Johnson to be released in the next coming days, according to the health minister. But there's also concern with regards to how many vaccination sites have been established nationally. We know it was supposed to be over 200, and then now it's been dropped to about 87. So the minister is saying that they know this is a concern, but by the end of the week they do expect to have about 200 vaccination sites nationally. And what's also key here is that Gauteng has about 1.3 million senior citizens and elderly that they need to target to vaccinate. We know just over 290,000 have registered for the vaccine, those in the age group of 60 and above. So there's still a lot of work to be done, but the minister is satisfied with how phase 2, day 1, panned out. Let's listen to what the minister said.
It's a very exciting day. Here now we came to launch the phase 2 of our national vaccination campaign. We want to announce that we have started, and the indications are that all the sites we had announced had actually started. We're also going to be increasing the numbers as the week goes by. I indicated yesterday that we'll start with about 87 today. Then by the end of the week we should have reached about 200, and then the numbers are going to keep increasing as the supply of vaccines increases. We have had the pleasure of visiting this particular site and looked at how the work is organized. We are quite impressed with the fact that the system put in place is working. In the first instance, we can see the collection of people who have been notified through the electronic vaccination data system to be brought in. We wanted to make sure that today the numbers are controlled, therefore, so that we can deal with the teething problems. And all the screening is happening, and I'm quite happy with it. And I've gone inside to look at how the registration happens. They check the registration, they register those who may not have been registered. That process is also going on quite smoothly. Inside the vaccination center, we have seen a lot of very experienced nurses. Those nurses know exactly what they're doing. I've been impressed with the fact that they've moved very fast, and it takes a very short time, a couple of minutes, to vaccinate and finish.
All right, so the ministers are fairly happy about how day 1 has gone. Of course, Gauteng is of particular concern because we heard late last week that we are officially in a 3rd wave now in Gauteng. So what did the Premier have to say when he visited the sites?
Yes, the Premier has indicated that despite the fact that we have inoculated over 470 healthcare workers and support staff, and now we have moved to phase 2 and phase 1B, that does not mean we need to let our guard down, particularly the elderly and those that have already been vaccinated. What's also key here, Sally, is the fact that there is a little bit of a concern with regards to the elderly not returning for their second jab. We do know that Pfizer is currently being rolled out, and we know initially that government had decided on rather having Johnson & Johnson in rural areas and remote areas, as it's easier to administer, but also with the elderly to not drag them to vaccination sites for a second time to get the second jab. So the Premier is saying that he's concerned with a number of things, but he does say that the challenges that are picked up are dealt with as quickly as possible to make sure that all vaccination sites and old age homes have the right facilities. Again, the Premier highlighting that vaccination sites will intensify, but we also heard the Minister just saying that the country might not be in a third wave, but 2 provinces, particularly Gauteng and the Free State, are of a big concern. So those are just some of the issues the Premier has picked up, but he is satisfied with the overall rollout of phase 2 day 1. Let's listen to the Premier of Gauteng.
So just looking at this site in Mansfield Township in the western district of our province, just looking at this site, things so far has gone well. I met the elderly people who are extremely positive, whose message has been that this is the right thing to do. And of course, what we are now going to be looking at, we are checking what's happening with all the other sites. We're also going to see with the follow-through. We know that we have started, Minister, we have started with fewer sites, but there are important lessons that we are drawing even this morning. We were checking if the registration is happening the way it is supposed to happen, including when there is a problem solving on site. If someone who is here and they have registered and there's a problem, there's problem solving on site. I watched problem solving happening when Dr. Khoza was being registered. I want to say to the healthcare workers across the province that this phase is extremely important. But I want to assure them that we are going to continue vaccinating the healthcare workers simultaneously with people 60 and above.
Premier David Makura there. So Heidi, day 1 in Gauteng is over. I would imagine it's all closed. You visited 3 sites in total. How did it go? And do you have any final tally of how many jabs were given out in Gauteng today in total, or are they still counting up?
We do understand that they are still counting up, Sally, because vaccination centres close. Some of them close at 3, some old age homes close at 4. They will most likely send out that statement later tonight when they send out the national picture. They will most likely stop counting at about 8:30. But just looking at the one vaccination site or old age home that we were at, it was about 70 people that agreed to take the vaccine out of 100 senior citizens. This particular health centre here in Dobsonville, we know they only managed to vaccinate 24 people, and the other community centre in the Krugersdorp, we're not exactly sure how many. So I'm sure they'll be able to give an exact figure later on this evening as they continue counting.
So thank you so much, Heidi. That is the picture in Gauteng. I want to move now to the other province that is experiencing a third wave, and that, of course, is Free State. Silindelo Masikane joins us, and I can see those very beautiful, distinctive mountains behind you near the Clarens area. You're in Putatichaba, I believe. How have things been in the Free State?
Well, Sally, it's been quite a chaotic start, I think, in terms of the vaccination of phase 2 here in the Free State. We understand that the province is aiming to vaccinate around 288 1,000 of its most vulnerable citizens. We understood today that only 2 vaccination sites rather were going to be activated, one here in Phuthaditjhaba, the other in Bloemfontein. However, the streets of Bloemfontein were a bit of a mess this morning with scenes of protest action. If you go onto social media, you would understand that since around 5 a.m. this morning, there's been a what we understand to be a hashtag Mangaung total shutdown, and these are residents of that particular municipality who have taken to the streets to air their grievances around the issues of service delivery as well as corruption in that particular municipality, calling for the disbandment of the council in that municipality. And so the vaccination sites in Bloemfontein did not actually go online today. No vaccinations took place there. However, here in Phuthaditjhaba, it was a much calmer situation, I must say, and it did seem as though officials were prepared to vaccinate around 120 elderly citizens at an old age home. However, you know, many of the senior citizens actually heeded the call and they made their way to that old age home, and we understand that over 200 of those elderly citizens have been vaccinated today. It was a slow process in the beginning, I must say, but then it seemed as though once more of the vaccines started arriving, that the process certainly speeded up. And the elderly were quite well taken care of. There was seating, there were heaters, there was food, there was beverages. So it just made that process, I think, a little easier for them. But let's just take a listen to what the Premier had to say around the total shutdown and its effects on the vaccination rollout.
The population of the Free State is 2.1 and we are supposed to vaccinate 1.9. And today we have started with grannies above 60 years and it went well. We expected 120 people, but you can see for yourself already they have just vaccinated more than 200. So things are getting fine and things will be okay. Just worried about Bloemfontein, but I'm sure we'll have to meet with the leaders of the shutdown strikes and see what is the problem and try to solve the problem. But because the most important thing now is to save our people, is to vaccinate our people.
We're hearing that the shutdown strike has talk that they want it to spread. Your message to those who are saying that you...
No, I just want to appeal to them, No, I don't think they should continue to do that because we are here, we are prepared to come and discuss with them, and definitely immediately when I arrive in Bloemfontein on Wednesday, I will make a chance to meet with the leaders and hear what is their problem. We can't be doing shutdown now, during this COVID-19. It's very dangerous now for our people. Let's save our people.
Yeah, so some real worries about that shutdown. We are also hearing reports that a child died in those Mangaung protests. Are you able to tell us if the police have confirmed that? And then also if you could tell us a little bit more about your conversation with the Health MEC as well today.
Certainly a very, very sad and tragic situation that's unfolded now in Bloemfontein surrounding those protest action. At this moment, details are still sketchy. I must admit, Sally, we have not received any confirmation as yet, but the reports that we have been getting is that somebody has been killed. We understand that it is a teenager, a boy, and at this point we are still just waiting for that official word from the SAPS around what transpired, how it happened. There are allegations that it's due to an owner, a foreign national who owns a business in that particular area. But at this stage, these details are all still quite sketchy, and the information is still coming out as the day progresses. But another major concern, of course, is the fact that the Free State is one of the provinces that are in its third wave. And I think the issue around protest actions, delaying the vaccination process is going to be something that government officials are really going to have to sort out. I mean, hearing the Premier in that earlier bite, she says that she will only be meeting with the leaders of this protest action on Wednesday, and I think Wednesday might just be a little too late. At this point, the MEC of Health in the province is just appealing for residents to continue observing COVID-19 protocols, really calling on people to do their best, because at this point it is in your hands, and the vaccine rollout, as we've seen, has been quite slow. So she's just put out an appeal and a call for people to register, to get their jabs, but to also continue observing COVID-19 protocols. Let's take a listen.
I'm encouraging people to get the vaccine. They must get vaccinated. There is reluctancy here and there. That is why we brought people like Marena, because leaders of the community are influencers. And so people, when they see older people here, getting the vaccine, enthusiasts, they are very happy. You can see they are happy. They were glad to get the vaccine. And I think people will follow the leaders. The leaders, what they did was good. But like we say, now that the old people have got the vaccine, it does not mean that now people can relax and put off their masks and not observe the non-pharmaceutical protocol. They must continue doing that.
All right, well, thank you very much, Lee. So that's the situation in the Free State. And now bringing you in, Lethiwe Mdluli, of course, you're in Kwazulu-Natal, not quite in the third wave yet, but we have seen numbers increasing. And, of course, it's a very densely populated province, lots of people. In fact, I think it's the most densely populated province in the country. You have been out and about. You've been to an old age home. You've spoken to people who got their vaccination. Just in terms of the logistics first, have things been fairly well organised from what you've been able to see in Durban?
Well, Sally, here in Durban, it's been a very slow start to the phase 2 vaccination rollout, as most of the people that were getting vaccinated today were the health workers, and just a few number of elderly people were actually vaccinated in KwaMashu, but majority of the people that were vaccinated today were healthcare workers. And this is due to the fact that the official launch here in KZN for the phase 2 rollout is only going to be taking place tomorrow, where the health MEC here in the province, Nomagugu Simelane Zulu, and also the Minister for Health, Zweli Mkhize, are going to be going to Pietermaritzburg for the official launch. We also know that the mayor of eThekwini is going to be visiting vaccination sites around the city just to basically make sure that they are ready for the vaccination rollout. And I visited townships such as KwaMashu Township today, and I also went to Phoenix to basically see some of the things that were happening at the vaccination sites. I did find that in KwaMashu, the official sites for the vaccination rollout had been moved to a different area. It was set to start in Princess Makoko Stadium, but it has been moved to the KwaMashu Sports Center, and today they were only just setting up, and they did tell me that they are only going to start vaccinating the elderly tomorrow. I did also visit an old age home yesterday in anticipation for today, and I spoke to the administrator at that old age home in Lamontville Township, who did say that they had actually registered all their residents at the old age home, and they had been waiting for the officials to actually say when they will come. I spoke to them today, and they did say that the officials did indicate that they'll only be coming to the old age home tomorrow. So the official vaccination rollouts for the elderly here in KZN is only going to kickstart tomorrow, and healthcare workers have been vaccinated, and they're hoping that they'll be finished with them by Thursday. But I did have a chat with someone who's in charge of the vaccination rollout here in the northern part of Durban, Thuli Majosi, and this is what she had to say.
The over 60s, we have sent teams out to do those that are in congregate settings like our nursing homes. But as soon as we finish our stuff, which could be about Wednesday, we then expect to rope in the rest of the over 60s from the community. But it will depend on the rollout of our healthcare workers. But since we don't have a lot of healthcare workers remaining, because some have already been vaccinated under the Sisonke project, we are anticipating that by Thursday we should be done with our healthcare workers.
Right, so quite a slow start to things in Durban, but thank you so much for that update. That was Lethiwe Mdluli coming to us from Durban, also from Buda Dichaba in the Free State, Silindelo Masikane, and thank you very much as well to Heidi Giokos reporting from Dobsonville in Soweto this evening.